Hey, what's going on, you guys? My name is Obed. I'm a recent medical school graduate who loves knowing more about the world. So for the next 30 minutes, stay tuned, and if you have any questions, feel free to put them down below. But wait, what am I saying? You already know this, so let's get started.
So I recently suffered an Achilles tendon rupture, and I've been asked over and over again, why is it taking so long for me to heal back to normal? Well, I'm at week number 8, and at this point, I think I know what I'm talking about.
What is the Achilles tendon? The Achilles tendon is a tendon that connects your calf muscle to your calcaneus bone. I know, that bone that no one wants to talk about. It's composed out of two muscles, your glorious gastrocnemius, which is the one everyone wants to show off at the gym, and your not so glorious soleus. Both muscles have the same function, which is plantar flexion, in other words, putting your foot down. So what do you do if this happens to you? First of all, I'm sorry, but this is going to suck for the next 12 weeks. Achilles ruptures are usually caused by forceful plantar flexion, sprints, jumps, or getting hit on the side. Other causes include fluoroquinolone use, steroids, and old age. First, don't panic, you're not the first one and you will get over it. As soon as you hear the snap, place your feet pointing down. If you decide to go to the ER, which I think you should, they will perform a Thompson's test and they will do an ultrasound and put you on a splint and tell you to follow with your primary care provider. So make sure you do that as soon as possible so you can get a referral to an orthopedist. Tendons do take a long time to heal due to a lack of vascularity, in other words, they get very little blood to them, and the remodeling process can also take several weeks. Once you get to this point, you have two options, surgery and non-surgery. Some of the complications with surgery include but are not limited to infections, nerve damage, chronic pain, numbness, and re-rupture. However, the healing process is a lot quicker. Some of the complications with non-surgery include re-rupture and pain. I decided to go for a non-surgical route, so in the descriptions I will link some of the protocols I follow. If you decide to go the surgical route, make sure you ask your orthopedist about your surgical options, such as open versus percutaneous. Some of the things that you will need to survive this week are a camp boot, field lifts, crutches, and an eye walk. So there it is, you guys, just a short and dirty rundown of the things you need to know if this happens to you. As always, these videos are not meant for medical purposes and should not be used as such. They are only for knowledge purposes. If you like this video, please like, comment, share, and subscribe. And if you want to know more about other topics, please comment on the section below. To all of you, stay healthy.